Dr. Cronenberg.
Hello.
Hello. In your daily practice, do you make the diagnosis of conversion disorder and chronic pain diagnoses?
On occasion, I do make a diagnosis of conversion. Um, it's a very complex diagnosis. Um, you first need to have um, a formulation that is beyond a reasonable doubt that it is conversion. And then the second question becomes, what do you do with it? Whether and how you actually share this with the patient. I think that's the more difficult question that I think we here at the Chronic Pain Clinic struggle quite a lot with. Um, I think part of it is sensing what the family is looking for, and there are different levels of readiness and insight. Um, Definitely, some families, if you just say conversion, and even if you fully explain it, it will sound completely odd and potentially not respectful enough. But there are some families that I've been in a situation where they actually thanked me for it because they were getting the feeling that someone is not telling them the truth. And they felt much better once they actually understood what that is. So I do use it. Um, I think another important issue with respect to conversion is if the diagnosis is given, to do it in the most respectful way, which means that this is not something that the patient is doing on purpose. This is not done for secondary gain. This is, if anything, an indication of how distressed they are, that the anxiety and negative emotions overwhelm them to the point that it is actually converted into physical symptoms. Um, so I explain it in a way that is as far from saying that it's all in your head, which is one main pitfall. The second thing is, I never say it and then leave that with the patient. That means if I do give a diagnosis, I make sure that either myself or someone else from the team can actually work with the patient and family and process what that means. Otherwise, you've kind of thrown a bomb and that's about it. Also, I think it's important to balance the risk benefit. And by that I mean, I think it's very clear to us what is the risk of telling someone that they have conversion. Um, Although even that is debatable because there have been some family who actually appreciate the diagnosis. I think what we don't talk about enough is what is the risk of not giving the diagnosis? What is the risk of continuing to shop from physician to physician or actually developing contractures that are secondary to conversion? And we had some cases of young women with bona fide CRPS on top of that superimposed conversion, which made the actual physical therapy work very difficult to do. So the risk of doing nothing, the risk of not giving the diagnosis needs to be balanced as well um, when you take all those considerations. And lastly, what I tell a lot of my patients, and also what I tell myself to feel more comfortable doing so, is that by the time patients come to us and they've shopped around and everything is negative, they're completely stuck. And you can almost promise them that they're not going to get better because they're stuck. On the other way around, changing the direction of the ship towards thinking of mental health and conversion gives a chance of improvement, gives a chance of taking a big leap forward. So sometimes the choice is between doing things as they are with guaranteed failure or giving the patient a chance. And a chance is better than nothing.
Thank you.